Hi guys, my name is Nikita Nelson and I will be presenting on the treatment of developmentally delayed sex offenders. What is a learning disability? There are three core criteria for having a learning disability, and it includes a significant impairment of intellectual functioning, so that means having an IQ of lower than 69, um, significant impairment of adaptive and social functioning, which means a person's effectiveness in meeting the standards expected of his or her age or cultural group in at least two of the following categories: communication, self-care, home living, social interpersonal skills, use of community resources, self-direction, functional academic skills, work, health, and safety. And all of this has to be present prior to the age of 18. What is a sex offender? A sex offender is a person who has sexual contact with another person without that person's consent, and all adult sexual contacts with children. Prevalence: approximately 2.5 to 3% of the general population is developmentally delayed. Studies found that the prevalence rates for individuals with learning disabilities is slightly higher in offender populations than in general populations. Lund 1990 found that 72% of patients with a learning disability reoffend any offense over 10 years. Gibbons and Robertson 1983 reported a reconviction rate of 68% in patients with learning disabilities detained under hospital orders. People with intellectual disabilities are often targets for sexual abuse, and some have sexually offended not long after having been abused themselves. Dynamic/criminogenic needs. Developmentally delayed people often live in environments that limit sexual relationships and privacy, even when engaging in personal sexual behavior. They often receive little to no education about sexuality as children or youth, and their parents may struggle to discuss these concepts in meaningful ways. Treatment. While there is limited research, clinical evidence suggests that specialized sex offender treatment may also reduce recidivism rates for developmentally delayed sex offenders. Effective interventions may enable the developmentally delayed offender to better manage his or her life with the goal of being reintegrated into the community. The primary goals of treatment are to minimize the risk to the community, reduce offenders' sexual offending behaviors, and help them gain control over sexual impulses. Help the offender develop appropriate social skills, including sexual expression. Reintegrate the offender into the community to enjoy a lifestyle that is independent of practical, that is as independent as practical, given the limits of his or her developmental delay. Individuals with developmental delay can benefit from standard treatment groups and cognitively oriented therapeutic approaches when these approaches are adapted to their cognitive strengths and weaknesses. Treatments may be relatively ineffective if they rely on verbal techniques for teaching abstract concepts. The risk needs responsivity. R&R will provide significant guidance regarding client placement, treatment need, and ongoing case management concerns. Conducting assessments should gather as much detail as possible. His or her circumstances, details that will help us understand what happened, why it happened, and what are the chances that it may happen again. This assessment data is also used to compose risk management plans. The following sources may be considered: a structured interview between the person who committed the offense and the individual performing the assessment, self-reports from both victims or victim statements when available, and client collateral contacts, which include family and friends, police reports, prior criminal justice reports, etc. Other official documents such as court transcripts, judges' reasons for sentencing, pre-sentencing reports, any prior mental health reports, psychological tests, risk assessment measures, results of sexual preference, interests, Good Lives Good Lives Model. Good Lives Model uses cognitive behavioral approaches that are skill-based and they match the intensity of treatment programming to risk level. It ensures that the treatment programs principally target the problem areas most related to the offending. It individualizes treatment plans to the specific criminogenic needs of the client. It increases motivation through attention to responsivity. It intervenes in offending pattern. It focuses on personal identity, increasing self-efficacy and approach goals. It develops compensatory strategies specific to offending pathways. It addresses environmental influences and concerns, increases basic skill for community engagement, and it develops a wraparound risk management supports within the community. Sociosexual knowledge and attitudes assessment tool. This assessment tool is effective for identifying, with the use of concrete pictures, a person's understanding in the areas of anatomy, men or women's bodies, intimacy, pregnancy, birth control, and healthy boundaries. Responses provide examiners with the individual's understanding and attitudes about specific sexual situations. The test is normed on the level of ID. This helps determine how much risk is related to the lack of understanding versus possible deviance. The assessment risks of manageability of individuals with developmental and intellectual limitations who sexually offend, or armadillos. It assesses both acute and stable risk factors related to people with ID. And I've attached the table on the following slide. It's an effective tool because it assesses risks as an ongoing relationship between the individual and his or her environment. As you can see, some stable items are supervision, compliance, treatment, compliance, sexual deviance. Some stable environmental factors would be the staff's attitude towards the individual, the consistency of supervision. Acute items that measures the change would be sexual preoccupation, the victim-related behaviors, emotional coping. And acute environmental factors would be changes in monitoring, changes in social relationships, changes in victim access. Psychosexual evaluations can also be used as risk assessment, but there are pros and cons. The pros are that it's beneficial when used to assess the likelihood of one committing another offense and identifying a plan to reduce the risk, and it can help the courts and teams identify appropriate treatment and specific supports needed to function safely in the community. The cons is that it cannot tell you if someone will commit another offense, and it can't tell you if someone has committed an offense. And this is basically a little chart that was associated with that section, and it just reiterates what I just read. Based on the literature I viewed, I don't think there's enough specific demographic information on developmentally delayed sex offenders, such as age, race, gender. And I believe in order to successfully treat an offender, especially using GLM, that it would be, imperative to know that much. This will make the treatment options a bit better, in my opinion. And these are a list of my references. Thank you guys for listening.